Welcome to education on the delay or withdrawal of services for community programs. The standardized process and procedure applies to community programs across Interior Health. Ellen has been seeing Ron in clinic the past few weeks. She feels apprehensive prior to the appointment, as he often becomes angry during their appointments. She recognizes Ron is becoming increasingly irritated and gives him space. She tries to de-escalate the situation, but feels helpless. Despite her best efforts, Ron calls Ellen an idiot and storms out of the office. Ellen feels shaken, frustrated, and honestly, Ron scares her with his volatile temper. She takes a few minutes to settle herself, but still feels upset and unsure what she should do next for Ron. Jennifer, Ellen's colleague and friend, notices how upset she is and asks what's happened. She sits with Ellen and offers support while Ellen describes what has just occurred. Jennifer lets Ellen know that they should review the situation using the delay or withdrawal of service standardized process. She explains that the first step is to determine the level of risk using the risk assessment matrix. Once the level of risk is assessed, next steps can be determined using the risk identification algorithm included in the standardized process document. Together, they open the delay or withdrawal of service standardized process on the inside net. Ellen admits she hadn't previously looked very closely at this document and thinks it might be helpful in determining next steps with Ron. She notices one level of risk is medium-low. She's not sure how this risk level would impact the care she provides. She looks closer at the algorithm and notices clear guidelines in regards to next steps for a person assessed as a medium or low risk. The next area of the algorithm, which Ellen and Jennifer review, is high risk. Both are unsure how they would provide care, so look closer at the algorithm. Both are a bit surprised to see the algorithm supports delaying or withdrawing services for persons assessed as high risk. The third risk level identified in the algorithm is extreme. They look closer at the algorithm to see how care would be impacted if the risk level was assessed as extreme. They note the directions for immediate withdrawal of services. Both are glad they are spending the time to review this procedure. In summary, if risk is determined to be extreme, withdraw services immediately. Notify your manager or their delegate and complete the required documentation, ensuring you update the HARP as appropriate. But then what, you ask? Ellen and Jennifer reflect on the interactions which just occurred with Ron. Both look to the risk matrix to better assess the situation and determine level of risk. First, they consider the likelihood of the behavior. Ellen notes Ron always becomes angry during his appointments. Next, they consider the consequences. Ellen indicates she has reported the incidents but is feeling increasingly anxious and having nightmares about Ron. Given this assessment, Ron is assessed at a high risk due to the repeated occurrences and impact on Ellen. Ellen initiates the delay withholding of service document and reviews this with her manager. Her manager offers support to Ellen and indicates she will follow up with Ron. The manager sends Ron the withdrawal of services letter and offers to meet with him to determine how to meet his care needs. The delay or withdrawal of services for community standardized process assists clinicians in determining a level of risk and next steps once this risk level is understood. Additionally, a similar process can be used for non-participation in care. We hope this brief video helps you in understanding the delay withdrawal of services for community standardized process. If you need further information or for assistance in using the risk matrix, reach out to your site leadership.